2022 is kind of heart-wrenching. I attended 6 funerals in that 1 year. All the children was under the age of 24 due to overdose. If they would have had naloxone, I think that would have saved their life. In our community, as small as it is, we was one of the top overdose places in America. You can save somebody's life and present this naloxone, then you got a better chance of other people getting on board with it and also doing the same thing in the future.
I think normalization is really a mindset change. And when you have one group of people that is undergoing this mindset change, talking about something differently, taking different actions, I think that ripples out into not only, people's families and friends, but the communities at large in which we operate.
There's a lot of stigma around opioid overdose cases. A study was conducted by the National Safety Council, and it showed that there are more opioid overdose deaths now than car accidents per year. So I think when you share the data and people are aware that it's a present danger, you just don't hear about it a lot because of the stigma surrounding it. People really are shocked by how often this is occurring, how big an issue it is, and seem to get on board pretty quickly.
It impacts the employees, whether it's a family member, a friend, could just be an acquaintance that you deal with in the community. You're going to know somebody that's been directly impacted, faced an overdose, knows of the overdose, attended a funeral. It happens here.
As someone who grew up in Huntington, I've seen far too many people impacted by the opioid crisis. I've lost too many friends and family, coworkers. I'm really glad that we're taking this initiative.
It just takes one person to say yes. It just takes one leader, one decision maker to say that we're going to go for this. So at Koppers, we call our safety department Zero Harm. And the motto is because zero means everything. When our CEO, Leroy Ball, brought Zero Harm about, he was told that it would never work and that this is manufacturing, this is a tough industry, you can't do all of these things. And, 7-8 years later, this is the way that we operate, right? Zero means zero.
And implementing a naloxone program goes hand in hand with that. There's a lot of data out there that says that a potential opioid overdose is a real concern and a real risk to our employees, our contractors, our visitors at our location. So from a safety management systems perspective, embedding naloxone into that is critical to ensure that we're covering all the bases as it relates to protecting our employees. We wanted to make sure that all of our employees at all of our operating locations were aware of what the signs of an opioid overdose are, how to safely administer naloxone, and overall how to respond to any emergency situation.
The employees responded very well to this training. It was clear to me this particular topic resonated with them. There was a lot more follow-up discussion compared to other trainings.
Well, any employer that would have the back of their employees to make sure they have any and every necessary need to survive through is a great employee or a benefit to any employee that want to work for them.
Having the naloxone here is a perfect thing.
Training employees on how to identify and respond to an opioid overdose situation goes beyond just the workplace. There's a lot of situations out in the public where you could come across an opioid overdose.
It gave me a sense of accomplishment of not having to worry about somebody dying at the workplace. We have that preventative measure to save someone's life.
If I had a message to share with other employers about implementing a naloxone program, I'd tell you that it's a lot easier than you think it is. I think it took us less than 3 months from the time we brought it up to the NSC asking for potential assistance till we actually had naloxone in every AED cabinet at our 30+ operating locations in the United States.
The employees went through the training, realized it's easy to use and where it's located.
If we as a company as a whole can save someone's life, then I feel that not only are we giving back to the community, but we're continuing our leadership within this community that shows people that we care.
I'm glad that Koppers got on board with that, and it's really going to be a great thing for the employees moving forward. So I think by Koppers doing it, maybe the other companies around my community will get on board and do the same.